the nurse's perspective, the travel nurse life cycle, as we refer to it in our company, is initially engagement. And this is where we discover what the nurse is looking for. This is where the nurse should be really figuring out what the company stands for, what the agency can offer them, both jobs and the locations, compensation, but again, experience. What does this company stand for, and what can I hold them to when looking forward to try entrusting that agency with your employment? And from there, assuming the nurse likes what they hear, they go into the application phase. This is where we create what we call your submission profile, which is in essence a juiced up resume. And this is what we use to not just sell you to hospitals, but best sell you to hospitals. And when we are getting ready to submit you, after your application is complete and your submission profile is complete, you will actually touch base again with your traveler advocate and go over all of the jobs that you may be interested in. And our policy is you must give us the green light to submit you anywhere. We don't want to just assume and submit you anywhere without you knowing and giving us the approval to do so, because we want you to be willing to work anywhere that we submit you, because we're going to work really hard and utilize and leverage our relationships with hospitals to fight for an interview for you. We don't want to waste the hospital's time, and we certainly don't want to waste yours. From there, as I said, you pick where you want to be submitted, and the account manager in our organization will submit you to the hospital and fight to turn that submission into an interview. You interview with the hospital as you would, for any other job, and the all the terms that you want in your contract, all that you want to know about the hospital, the unit, the shift, all of that stuff is discussed. You are interviewing the hospital as much as they are interviewing you. And assuming that goes well, they extend an offer. We negotiate terms between yourself and the hospital to come to a nice middle ground where everybody is happy. We sign the contract, send it out to you. You sign the contract, we notify the hospital, and boom, you are now in contract to work the assignment. Typically, though, you will not start for at least 2 or 3 weeks. And in that 2 or 3 week period, our objective and goal is to get you cleared to start. This is drug screens, physicals, any additional tests that the hospital may require, any other employment documentation that is required to be completed by both us and the hospital will all be done in this time. And then from there, you are working. You're making a lot of money, enjoying your experience, and our team, every step of the way, is your traveler advocate will ensure that you are enjoying it. Will ensure that there are no issues. We will follow up with the hospital as well to ensure that they are enjoying you and making sure there are no issues from their perspective, so we can make this as enjoyable for both the hospital and the traveler as much as possible. And fast forward to about 6 or 8 weeks, 4 to 6 weeks before your contract ends, your traveler advocate's going to start bringing up the possibility of either extending at that hospital or continuing your employment with Nurse First, just at a different facility, in which case the submission process will begin all over.